So what else can be done other than a computer-based test to identify concussion? Well, there's several other parameters that we do in our clinic. So one thing that makes us a little more comprehensive is we're not just sitting you behind a laptop and trying to figure out kind of where your concussion symptoms stand. We're going to do some neck testing because a lot of times there's a whiplash component or cervical neck instability issues that can kind of mask themselves as MTBI, so like a mild traumatic brain injury or concussion type syndrome. So we've got to look into neck stability. We've got to look at visual motor, meaning can your eyes track and do what they need to do? And then from that point, if there is something that shows up, can we provide the appropriate level of challenge for gaze stabilization and visual motor retraining to assist in getting your eyes to function well? A lot of times when things get a little bit scrambled, if there is a little bit of lag or dysfunction there, that conflicting information really is to some degree confusing for the brain. That kind of faulty information really just kind of sets the world in off kilter. So that's why a lot of times you feel just unsteady or the world moves a little at a different speed or otherwise at post-concussion. Visual gaze stabilization is a component of it. There's vestibular, inner ear balance type things that we can start to work on and identify, is there a problem here, and start to, again, retrain some of these systems to get your body back online, back on board, feeling like a normal human being again. So it's not just a computer. There's a ton of other things that we can try to get our body kind of to begin to retrain. And then the final phase for me is if you're somebody who is an athlete who has to challenge themselves, who has to get the heart rate up and has to push their body to kind of red line limits, kind of zone 5 heart rate, what we're looking at is we're going to do a chest strap monitored cardiac stress test. So we're really going to get that heart rate up and find what parameters you can reach without really affecting your concussion symptoms. So if we can find that level and say, hey, you know what? Things start to kick off at zone 4. Well, cool. We're going to find that zone 3 and let you know, hey, I want you to start being more active and keep your heart rate within this kind of zone 3. Depending on your age, we can kind of identify your zones and give you a proper prescription of care, find the level of activity that you should be working on. Is there something outside of our walls that you could be considering? Things like hyperbaric oxygen therapy or some of these other adjunctive treatments that are available. But one, when you get in our hands, we're going to be able to kind of guide you appropriately. So we've been at this for a long time. I feel like we're pretty good at it. So if you need some help, feel free and reach out to us. We've got your answer.